So just to start with, I think it would be best if I share with you my story. Because everything in these slides is about the company. But my story with digital health was not the beginning of Right Angle. When we started Right Angle, we started it with a product, with a medical device, a point-of-care testing technology that would detect DNA sequences from a fingerprint. Now, that's a technology that I was working on while I was doing my studies at Warwick Uni. And during that time, we went on to develop the proof of concept. We went on to file the patent. And then we found ourselves stumbled across what every other innovator in this medical diagnostic field would find himself in, is writing up grants to de-risk the proposition for investors to come in. Now, coming from a foreign background and English not being my first language, I kind of struggled. And we actually filed a couple of grants, and they both came back refused. And the main feedback has been coming on like, in way, like, we don't understand what you're trying to say here. So, so eventually we came to realize that if we were to keep on this route, we would become really skilled in writing, but we would not really get very far away in our product development. During that time, my co-founder, who is a service designer, told me about a condition that was going on in her family. A family member was suffering from certain episodes that come as side effects from a drug called Plavix, which is an anticoagulant. And the drug was causing her relative a lot of pain. It was showing a lot of bleeding, gum bleeding, bruises, which are the common side effects of this drug. And with my background and my research and my studies in genetics, I knew that pharmacogenetics is the way to optimize the treatment for this patient. And a genetic test should have been done for this patient to know whether or not the drug is working for her. Now, given that this lady had already survived 5 strokes, she was constantly put on the same medication again and again and again, because there was no way to understand that there is something wrong with that patient. There's something wrong with the drug, the way the drug is being metabolized in her system. So my co-founder, my colleague at the time, came to me, told me that this is the situation. I told her genetics is the solution. She went back to her relative, who went back to the cardiologist and told them, could we do a genetic test to optimize the treatment? Now the cardiologist said, that's great, genetics have a lot of potential. However, I don't have access to this technology. I don't have access to it. I don't know how it's gonna help me to develop to optimize the treatment. Like, there's quite a lot of barriers, and unfortunately I can't do the test for you. So that was the time when my co-founder and me decided looking into how we can make this information accessible. How can we, and that actually I think taps in a way to accessibility. That's what digital health is about. And I will come to this later on in my slides. So in essence, we had to develop a service design that would allow genetic testing to become accessible, to be affordable, so automating the process really for all stakeholders in that chain, and to make it very easy to understand, because that was another barrier, that we can have digital technologies to help us communicate and be able to simplify for the end users. So we founded Right Angle. Right Angle, we are a CQC registered company, so what CQC means is that we are regulated by the same regulatory body that regulates hospitals, NHS trusts, clinics, so we are kind of legit in a way. We have been backed by the West Midlands Academic Health Science Network to develop this online platform, which is the idea on which we have offered the service through. So our idea is really to mainstream DNA testing. That's the goal, that's the objective in what we're doing. Our service, our DNA testing service includes this online platform that we had to custom build. We had to custom build this online platform to enable us to provide users with accurate information that has been reviewed by specialists, and provide users with a portal where they can receive that information after it has been reviewed by that specialist. So the reason for that is because when we looked into the market, when we looked at the offerings in the market, we understood a simple thing, that there's a lot of this, what they call it, direct-to-consumer genetic testing companies that provide information directly to people and tell them, off you go, that's what you are destined to be. Now, scientifically, factually speaking, that's not true. It's a simple equation that we always repeat at the company. It's genetics plus environment equals phenotype. What that means is that it's the combination between your genetics and your lifestyle, your daily choices, everything that you do in your environment that actually influences the way that you develop to go on to develop a certain physical characteristic, which is what we call as phenotype. So we had to bring these two sets of information to a specialist who can make an assessment, who can make a review, and provide you with an action plan. Because that's what's been missing in the industry. It's, what am I going to do with this information? How is this information going to help me? Okay, when it's drug response, it's a very clear pathway. This drug will work for you, this drug will not work for you, this is the dosage that you should take, that you should start on, or this is the dosage that you should not start on. But when it comes to cardiovascular risk assessment, analysis, giving that assessment to patients, how are we going to minimize that risk? And that's where the specialist is an integral part in that process. And that's why we developed this platform. So, in essence, the platform has been specifically designed to enable an easy way for medical practitioners to integrate personalized medicine within their routine practice. All they need to do is sign up to our platform, log into their accounts, and see a list of patients assigned to them. Now, from the face of it, it sounds easy, but developing the platform took us 6 months. And it wouldn't have happened without the funding from the WMAHSN. So, in a way, this is what we have developed. The way that it works is very easy, very simple. We use the same model. We have DNA testing kits. These kits have a specific, not specific, it's just a swab. That swab they collect the samples with, they put it back in the box, and before they send it back, they register the barcode on our platform. By registering the barcode, they are creating their own account. Now, every user, when they create the account, we ask them to fill a set of questions. This questionnaire covers their general, usual information and their health information. The health information is derived from QRISK and GPS3, which is the usual conventional risk profiling that cardiologists usually ask the patient inside the clinic to be able to know where that patient is on that spectrum of risk over the next 10 years. So once the patient has filled in this information and created their account, they can collect the samples, they send it off by post. All kits are prepaid packages, so they are delivered directly to our partner labs, who do the analysis, give us the raw data, we upload it into the system, which automates the process of interpreting the results and generating the reports. Now, once the reports are generated, the doctor is first notified to log in and to do the review online and provide the recommendations and the assessments with the action plan on how they can minimize that risk and how they can optimize that treatment. And here I'm talking all about the hard DNA test, our first product. So review and online and adding the recommendations. Once that has been signed off by the doctor from their portals, the patient is then notified to log into their account and view the list of, view their reports with the doctor's assessment. All this service is all inclusive with our testing, and we have enabled just like actually from the moment that we launched the first product, we were enabling the users to follow up with appointments with the partner doctor who have been assigned to them. So if they wish to follow up with these results and their assessments with an appointment over the phone or in person, they can book that appointment directly with the consultant. So in July last year, we launched the hard DNA test. It's our flagship product. It's a DNA screening test for cardiac conditions, drug responses, risk evaluation for developing blood clots, and abnormal levels of cholesterol, triglycerides, and all these lipids that we test for. So the full list is there. Now, the thrombophilia test is now covered by the pump. So, just before I move into what we have been doing over the past 6 months, this product, when we first launched it, we had to be able to communicate the value proposition to patients. We had to communicate the value propositions to doctors. And that's where I think, which is not part of my slides, but I think being out there, being active on your social media, being active on your online channels is the most effective way to deliver your messaging. Nowadays, I think a lot of people don't understand the power of the simple email marketing. It's a very simple, powerful tool, as long as you're compatible with GDPR, of course. But it's a very, very effective tool to actually communicate your messaging to the people that are interested in what you're doing. So use it in a simple way. So over the past 6 months, we have been working on 2 products. We have been able to leverage our platform to introduce a fitness test. The fitness DNA test is a test that we are so excited about. We have literally just launched it 2 weeks ago. And with the same model, we are now doing DNA testing for people's exercise responses, body and weight management, diet and nutrition, but giving that context on the back of these reports by taking into account their environment, their self-reported health information, as well as their objectives. So with that model in mind, we now partner with personal trainers who are qualified nutritionists to provide 8 weeks action plans to our users, where they can optimize their exercise, where they can optimize their diet and nutrition. And we have bundled the fitness DNA test with the heart DNA test into a Wellness Pro package. So the Wellness Pro is really the 360 degrees cardio fitness test that looks onto your health and fitness from both cardiac and fitness side. And it's reviewed by cardiologists and personal trainers who are also qualified nutritionists. Now, that's in terms of our 3 products that we currently have released. We have a couple of more products to work on for the next year. We actually have the mental health medication drug response test, and with the cancer test will be coming later by the end of next year. Now, I don't know why I put this because I just put it on how we actually work. We have 3 routes to market, business 101. We sell direct to businesses, where we are working with clinics and these consultants who are who are partners with us, where we can sell the kits to them and they can resell as part of their in-house screening packages. We also work with occupational health service providers as well as companies who want to provide these packages to their employees. And we also do strategic business partnerships. So we will be going into 2 business partnerships, one with a mobile app that actually delivers doctors to your doorstep. I can't say the name, but this is something that we are now doing the training for their GPs on how they can interpret the results. And of course, again, the online platform will help us now to automate the process by bringing these webinars onto the partners portal directly so they can become up and running basically on their own. Now, in terms of the genetic testing integration, how it's working, this is something that I left after my thank you slide. If you'd like me to go through it, I can show you how it works inside the clinic. But from a business-to-business perspective, we also sell directly to independent retail channels, pharmacies, gyms now is our next target, but we're already stocked in pharmacies and a number of health and fitness retail shops that actually had an interest in the heart DNA test. By now we're pushing the fitness DNA test out into these channels as well. So that's in terms of the B2B side. In terms of from the B2C perspective, we sell direct to our online website, as well as doing the referrals where we can get referral letters from consultants to send the kits to patients. Now this is what we are doing with Bupa right now. So all Bupa consultants can refer patients for us for the thrombophilia testing, where we can send the kits directly to the patient. And of course, for our future plans, we want to move into more R&D based services, where we can work with research organizations. That's the perspective that we want to move into. We we will be talking with a number of research organizations that would have an interest in genetic research in terms of cardiac health and in terms of fitness action. As a matter of fact, we will be running a project with Coventry University in a few months' time. We will be trialing our fitness testing with a cohort of their athletes. R&D in ANI is quite the obvious way that any company wants to delve into, and it's quite the obvious route for us as well to move into, as we are anonymizing data for patients' self-reported information, as well as their genetic results and the doctor's assessment on the back of it, which represents the human factor interpretation on these two sets of information. Thank you very much. That's pretty much what we do.